washing. So the purpose of these skills is to remove potentially infective microorganisms from our hands. So for our assessment, let's inspect the hands for any breaks, cuts, lesions, cuticles, and if there is lesions, let's dress it before providing care. And also, let's inspect the hands for visible soiling, and let's inspect the condition of our nails. It should be short and smooth. And hand washing, we should perform hand washing before and after providing care to the patient, after using the toilet, and before and after eating. Next, for our planning, let's identify the expected outcomes. So for our implementation, first let's remove our wreaths along with our uniform sleeves, and also remove any rings because it can harbor microorganisms. Next is there are two types of hand washing. First is we use antiseptic hand rub or using disinfectant like alcohol, and next is using soap and water. So first, let's perform antiseptic hand rub. So first, let's dispense or put appropriate amount of alcohol or product of into our palm, and let's rub the hands together, and it should cover all the surfaces. And next, allow the alcohol to dry, and let's after drying, we can now perform applying gloves. So next is next type is using antimicrobial hand soap. So first, let's stood in front of the sink. Keep the hands and the uniform away from the sink surface. Next is let's turn on the water. Then next is let's turn on the water. We can use a faucet or pedal to regulate the flow and temperature. Next is let's avoid splashing the water against our uniform. Then next is let's regulate the flow of the water and the temperature. The temperature should be warm. And next is let's wet the hands and wrists. It should be, let's keep our hands and forearms below the elbow or lower than the elbow. Then next, let's apply soap or appropriate amount of antiseptic soap and rub into the finger. So in washing our hands, it should be at least 15 to 20 seconds, or singing the happy birthday song twice. Then, so in washing our hands, we should follow this step. So, palm to palm. And then, rub each back of the hands. And then next is finger interlace. Next is finger interlocks. And then next is rub the palm of the hands and each fingers. And vice versa. And then next is rub the tip of the hands into the palm of the other hand. So in cleaning the undernails, we can use also other hand or disposable nail cleaner. Then vice versa, and then rub each wrist of the finger. Then next, let's rinse hands and wrists. Keep hands down and elbow up. Then next is, let's dry hands and wrists thoroughly. Dry hands. Then discard the paper towel in proper receptacles. And then next is, we can use a clean dry paper to turn off the faucet. Turn off the faucet or using a knee pedal. And next is let's apply and then discard. Then let's apply appropriate amount of lotion to hands. So now we are done in hand washing. So for our evaluation, let's inspect the surface of the hands for obvious signs of dirt and other contaminants. Next is let's inspect also the hands for dermatitis or cracked skin. So next is let's ask patient to describe how to wash hands. And also let's identify unexpected outcomes. So now I am done in performing hand washing.